You're watching UNICEF Television. South Halmahera, a cluster of picturesque islands in the Maluku Sea, a place where for centuries people have grown and traded exotic spices. But these islands face a deadly threat, one that many in other parts of Indonesia have since forgotten. And as night begins to fall, the danger emerges. It's the Anopheles mosquito, which carries the threat of malaria. In 2003, some 4,000 people in these islands were diagnosed with the disease, and more than 260 died. In small remote villages like Yamli, the devastation to the small community is all too real. Esther Rahmat lost her youngest baby a year ago, one of dozens of people, many of them young children, who have died of malaria over the past several years.
Anak saya yang kembar umur 1 tahun 9 bulan.
When my twins were 21 months old, the youngest died because she got malaria. I brought her to the clinic in Ganedalam village, but it was too late and they couldn't do much. The next morning, around 10 o'clock, she died and we buried her. After that, my older sister took the other twin to raise, so I no longer have her in my arms.
And Esther is not alone. Her neighbors, Marcha and Yosina, also lost their babies.
Anak saya umur 1 tahun lebih sakit di situ. Semalam dia panas.
My 1-year-old daughter was sick, had a fever all night before she died. She had a headache and runny nose, and a fever too. I was cold, my head hurt. I had a fever, but I felt so cold.
They gave me medicine and they said if there wasn't any change, I should take her to the main island Bacan. That was on a Saturday. By Monday morning, she had passed away, so it was too late to go to Bacan. She was only 3 when she died.
Remote villages like Yamli are at particular risk. They're surrounded by dense forests and muddy swamps. This is where mosquitoes thrive, and for the local community, it's the major health threat.
As the leader of this village, I have started a program to build a gutter system to reduce the threat of malaria. Apart from that, we have to maintain a clean environment, so we have to get rid of stagnant water, so that malaria will leave our village.
And once the water flows, the threat of malaria is reduced, but it takes much more to fight this battle. And Yamli cannot do it alone. This village and many more like it that dot the coastline are up to a day away by boat from the district capital Labuha, headquarters for the local malaria control program. Here in South Halmahera, a district of some 190,000 people, a strong partnership between the local government and UNICEF has helped reduce the number of malaria cases. The regent, Muhammad Kasuba, takes a special interest in the program, having been a victim of malaria himself.
Dan tentunya sampai tahun 2010 kita berharap di atas 30–40% masalah malaria kita.
We hope that by the year 2010, we can reduce the incidence of malaria by 30–40%. At the very least, reduce the number of deaths and overall cases, so the district is no longer endemic. We are also promoting an integrated malaria, immunization, and mother and child program.
Kesehatan ibu dan anak.
This is one of the first lines of defense in the malaria program, bednets that have been impregnated with insecticide. These were donated by the Global Fund and UNICEF's Czechoslovakian and UK National Committee, with program support from USAID. It's all part of the global malaria campaign.
If coverage of mosquito nets is high enough, that is, if all members of the community have mosquito nets and use them, then studies have shown that the overall population of mosquitoes is reduced and everyone is protected, even people who are not using nets. So we have a direct effect of protection for people who are using nets, and then we also have a community level effect if coverage is high, whereby mosquito populations are reduced and transmission to the community as a whole is reduced.
This program is unique as it works hand in hand with both the immunization and women and children's health programs. While getting these nets and vaccines to remote areas requires a strong commitment on the part of all health workers. This is where all the planning and logistics come together, right here at the Village Health Center. This is where the most vulnerable groups, pregnant women and women with young babies, come to get life-saving mosquito nets. They also get immunization and other health care as part of this comprehensive program. Today, health workers and community volunteers are in Kobalabala for a regular monthly visit. Pregnant mothers and children receive medical care, nutritional advice, and for the children, immunization. Sakina has brought her daughter Witri in for her 9-month measles shot. This is the last of the basic immunizations, and as a reward, she gets a bednet. Sakina is also told how to care for her bednet, which with the insecticide should last for about 3 years. Pregnant women are also a priority for the bednet program in an effort to protect the health of the mother and unborn baby.
When a pregnant woman visits us for the first time, we give them a quick blood test to see if they have malaria. And if it turns out they have the disease, we provide medication. They are also given a bednet.
Controlling and then eliminating a killer like malaria requires a consistent program that is implemented year after year with support from government and communities alike. Regent Kasuba pledged to fight this war on malaria so that no mother or child will be a victim again.
I would like to take this opportunity today to announce that we will reallocate village funds specifically for bed nets so that all people of South Halmahera will be protected.
Sakina's part in this war on malaria is to make sure she and her baby always sleep under a bed net. These nets are longer lasting than their predecessors and can be washed and dried when needed. They also help reduce the mosquito population. But for Sakina and Witri, it's a safe haven. The effort to control malaria has been successful in many parts of Indonesia, and it has been eliminated in many countries around the world. Indonesia says it hopes to reach that goal in 2030. But it's not easy. The program needs to be maintained and expanded so that mothers like Esther will no longer have to grieve the loss of a child to malaria. This is Susanna Dane and Anton Susanto for UNICEF Indonesia. Unite for children.